Hello, and welcome to the Presto Sizing and Proper Application of Adult Incontinence Products video. In this short video, you'll learn how to properly size incontinence briefs, how to properly fit them, and understand what improper fitting looks like. So let's begin. Most leaks and skin irritations are caused by improper fit. No two people are the same. Height, weight, and absorbency needs are as unique as they are. Sometimes the client may have anomalies such as large thighs, or medical conditions such as amputations or hernias that make sizing a bit more challenging. So how do you size someone for absorbent products? What do you need to keep in mind when doing sizing, and what should proper fit look like? There are two ways to size for absorbent products. Choose the method that works best for you and your client. First is the chart method. On the left, you'll see the heights, and across the top will be the weight. Where those 2 points intersect will be the proper size. Since the box falls in the area outlined in red, a medium would be the correct choice. If you find that your size falls on or very near the dividing line, choosing the larger size seems to work best. Another option is the measurement method. All you need is a simple tape measure. If your client is standing, wrap the tape measure around their waist and hips. The correct size is the larger of these two measurements. If they are lying in bed, take the tape measure and go from hip bone to hip bone. Use that measurement and multiply by 2. Then add 2 more inches to get the correct size. Briefs are tightly packed in their bag for transport. A quick and easy way to increase the absorbency and make them work faster is to fold the brief like a taco. Run your hand down the spine of the brief quickly. You'll feel the brief get thicker and the leg elastics spring into shape. It makes getting that brief where it should be so much easier. When we do this, we separate the polymer and fluff. This allows the urine to pass into the brief more quickly and efficiently. The key to a good fit is both sizing and proper application. The brief should lay flat across the abdomen. The wetness indicator should be midline. The top hook and loop fastener should be pointed down to tighten up the waistband and reduce leakage. The bottom tab should be angled slightly up to tighten up the leg gathers. Notice the material is not turned in and under the brief, and the fatty thigh fold is in the outside of the brief, making leakage more difficult. From the side, we'd expect proper fit to look like this. Similar position on the body, both front and back. Top tab in and down, and the bottom tab up on the wing area. Notice there is very little extra material on either side to get turned under and become an irritant. And from the back, we can see the wetness indicator is midline. The brief is flat and snug against the body, and there are no gaps around the leg. The leg gathers should be comfortable and non-binding. These sizing and application principles apply to all protective undergarments. Try to think about a client who you've seen whose absorbent product looks similar to any of the following. By the end of this video, you'll be able to identify lots of opportunities to improve the fit, feel, and performance of these products just by changing a few simple things. Although we might think that bigger is better, it's not. Improper application can and will have a negative effect on performance and skin health. How many times have you seen this? Tab to tab in the middle, lots of extra material on the sides, and bunched up in the middle? Or how about a brief that's too loose? No firm seal around the legs, thus allowing urine to leak right out the side. Or one that's too small. You can see where this might be a problem. And when it's not on properly in the front, there's a good chance it's not fitting properly in the rear. If the brief doesn't cover both cheeks, you'll have wet clothing or a wet bed. The easiest way to make sure this doesn't happen is to double check to see that the wetness indicator is midline on the body, both front and back. The wetness indicator is just that, an indicator. It will turn dark blue, green, black, or even partially disappear. This is not a gas gauge. It was never meant to tell you when the brief is half used or when it needs to be changed. It is only there to remind you that you need to further investigate. If a bowel movement is present, please change the product immediately. Perspiration and moisture can also cause the wetness indicator to change colors. To test the brief, give the product a squeeze, and when it feels like wet sand or gel over half the product, it's time for a change. If it still feels gritty and stiff, you may be able to allow the client to continue what they are doing and reassess in the near future. Sometimes measuring doesn't give the best fit. You may need to try a few sizes to get one that works best for your client. Sizing is not rocket science. Everyone can do it, but it's the key to maximizing the performance of the product and the comfort level of the user. Remember, the sizing guide is just that, a guide. Sometimes you need to experiment. If you see a product that's too big, get the next size down and give it a try. Sizing is contagious. If you put on the wrong size, the next person will put on the wrong size, and so on and so on. Remember, the most fitted brief is the best performing brief. We hope you enjoyed this video and have a better understanding of how to size and properly apply these products. And now you know what improper application of adult incontinent products looks like. Thanks for watching and for everything you do every day.